Hi friends, today we will continue our conversation on the topic of cholesterol, and today is cholesterol 2. I'm talking about statins. I want you to understand how they work, because once you know how they work, you understand their side effects. Here are side effects of cholesterol-lowering drugs such as Lovastatin, Pravastatin, and Lipitor. So there are more there. Look at that. Headache, dizziness. You're thinking, what the heck, this Veronica? She's throwing everything in this spot. Let's see what sticks. Like muscular pain, sleep problems, loss of libido, and even cancer. Today, I will talk a little bit about link between statins and cancer. When I started to prepare for this lecture, for this presentation, I did a little bit research, and I just Googled that. And I saw that there is very little information between statins and cancer. Why? It's because, my friends, I know a little bit history why there is no this information, research information. When statins came on the market in 1960s and 70s, pharmaceutical companies studied them, and they have what we call different arms. So they study and they look at the how the drug will affect blood pressure, how the drug will affect diabetes type 2, how it will have affect cholesterol, and does it have any effect on cancer? And that's called ARMS. After researching this drug for 6 or 8 months, pharmaceutical companies came to conclusion that there is no effect of this drug on cancer. So they drop cancer arm. Well, we know that cancer does not develop in 6 or 8 months. So the drug eventually was released into the public. And, people were taking the medication, and finally, information started to leak into medical communities because medical communities see the drug actually contributes to cancer formation. And there is a little bit research, but there is none from independent sources such as National Institute of Health, because it's subsidized by government. And what do we want? We want small, non-existent government. We want to fund it, and we want corporations run free. And that's the result. So, but let's go to our PowerPoint presentation. And what I'm going to do, I'm going to push on you a little bit biochemistry. So you will know why I said there is a link between statins and cancer, why physicians are talking about that. Oops, I skipped the slide. So I bunched for you to make it a little bit easier. So all the side effects: mental headache, general, digestive complaints, muscular pain, and here is endocrine. And I put here everything, including acne, osteoporosis, and cancer. Is it correct? No. But today you will understand why I put it here. It's let's go. So from my previous video that cholesterol formed in the body from acetyl coenzyme A through pathway called mevalonate pathway. Those arrows represent enzymes that convert one substance to another. So acetyl coenzyme A converted to different substances, and eventually it's converted to dolichol, cholesterol, and ubiquinone. And this is HMG coenzyme A reductase that drives this reaction right here. What statins do, they block this enzyme. As a result, here we produce less mevalonate. As a result, we produce less dolichols, cholesterol, and ubiquinone. When your cardiologist or primary care physician look at that cholesterol on the laboratory, yes, I'm very pleased. Cholesterol is lower. Your physician is happy. But are you happy? Look at that, what formed in our body out of cholesterol. We form bile acids. My subscribers already know that bile acids released from the liver and into small intestine. And what they do, they emulsify the fat that we just ate. When fat is emulsified, it's easy broken down by pancreatic enzymes called lipase. It's broken down. As a result, it's easy absorbed. If we don't produce enough good quality of bile acids, result, fat is not broken, is not emulsified, not broken down, not absorbed, and our body does not receive that. What are the fat? There are many substances, but some of them are very interesting. Vitamins, for example, called fat-soluble vitamins. vitamin A, E, K, and D. Now, here you see that when we lower the cholesterol, vitamin D becomes low. So, because it's not absorbed. But here is one more thing for you. I stole the slide from a medical journal. This slide is about formation of vitamin D3 active form from the cholesterol in the skin. Cholesterol get delivered into the skin, and under sun rays, it get formed into 1-dehydrocholesterol. The substance eventually get converted into active form of vitamin D3. By the way, I want to say for a second that everybody understand now that vitamin D3 is not actually a vitamin, it's a hormone, right? Why? Because it has a separate receptor on the surface of the cell. Here's the cell surface, blue one, and also on the nucleus. So the vitamin D3 active form flows in the bloodstream, get attached to the cell, and then here it is inside the cell, and then it get attached to the nucleus of the cell, and then it get attached to our DNA. So the green part is the DNA. And here is on this DNA, this hormone or vitamin D3 acts as a stop sign. So what it does, look at that. It slows down cell cycle through those chemical pathway. We know by definition that cancer is a fast growing and fast reproducing substance. So cancer is growing and reproducing really fast. What vitamin D does, it sits here and tells the cell, if it's cancer cell, stop grow and stop reproduce. Through this pathway, it's increased apoptosis. Apoptosis is a fancy medical word, means a death. So it tells the cell, don't reproduce, it's time to die, because cancer cells never die. So vitamin D is the signal to death. This pathway will decrease production of inflammatory substances such as COX-1 and COX-2. We know that the modern medicine in the last 20-25 years is all about the inflammation. Joint pain is inflammation, cardiovascular disease is inflammation, diabetes type 2 is inflammation, cancer is inflammation. The more inflammation you have in the body, more cancer you are going to have. So vitamin D3 will decrease inflammation. Here is another arrow points to angiogenesis, production of the blood vessels. When the cancer starts to grow and reproduce, it's increase in size and sends the signal into nearby blood vessel, telling them, hey, listen, I'm growing, I'm reproduced fast, I need more nutrients and I need more sugar supply. That signal tells the blood vessels, oh, I need to deliver blood right here into this area, and it does. What vitamin D does, it's control how much blood vessels get growing into the cancer. So it stops angiogenesis. This arrow is pointing to ecadherin. Ecadherin is all cells in our body attached to a base membrane. Most all of them, including cancer cells. When ecadherin is present, when pathologists looking at the cancer and say, oh, ecadherin is a high concentration, it means that cancer cell will stay put right here in this area. When the concentration of ecadherin in the cancer get lower, it means that the cancer cell get disattached from the cell and it's free to flow in different directions. Here we go, it's metastasis. So guys, now you understand the background. So are you going to take cholesterol lowering drugs? I am not sure if you should do that. Stay tuned, like, subscribe. Bye-bye for now, guys.